Hi, neighbors. My name is Matthew Dobler. I'm one of your commissioners here in Aleppo Township. As you know, we've been going through this series of videos that are designed to help you get to know the services that Aleppo Township offers and get to know things that you might know to make life in Aleppo better. So in the past, we've done videos with the Ohio Township Police Department on fraud. We've done videos with respect to trash collection. We've done videos with respect to services that are available through Allegheny County, through the Department of Health, and through the Area Agency on Aging. Today, I'm really happy to continue on with this series of videos, and we have with us today J.R. Henry, who is the Executive Director of the Valley Ambulance Authority, which is in short, it's the ambulance company that serves us here in Aleppo Township. And they serve other communities, and we'll get into that in just a second and how all that works. I had to tell you that when JR and I met to plan for this video, I learned all sorts of things that I did not know about how we as Aleppo residents are served by ambulances. So I'm really excited for you to understand some of this new information that I've gotten as well. JR has over 40 years of experience in helping people out through ambulances and the business of saving lives. So we're really glad to have him in the studio. Welcome, JR.
Thank you, man. I really appreciate the opportunity.
All right. And JR has a PowerPoint deck, so I'm going to turn it right over to him, and I'm going to let him lead us through this.
Great. Well, thanks again for the opportunity. Yeah, I actually served as the Executive Director of both the Valley Ambulance Authority and the Quaker Valley Ambulance Authority. And I'm sure your residents know that the Quaker Valley School District is made up of 11 different communities, including Aleppo. And so we're fortunate enough to be a municipal authority that provides ambulance service to a total of 15 communities, 4 for Valley on the other side of the river, and 11 on this side of the river for Quaker Valley. The relationship is really kind of unique, and a lot of people don't really understand it very clearly. So it's great to have this opportunity to present this information. So let's go back to the 1970s, before formal ambulance services were really organized in Pennsylvania. Most of the time, a funeral home had an ambulance service, or the police department threw you in the back of a station wagon and drove as fast as they could to the hospital. So back in 1972, Valley Ambulance Authority was formed, and it was the first municipal authority in the country, actually. So it was a real demonstration of good intergovernmental cooperation. And so 2 years later, that was so successful. The folks on this side of the river, the Quaker Valley School District municipalities, decided that was a good model and they'd like to emulate that. But they also had the vision that they didn't want to duplicate what Valley had already created for the 4 communities, including Coraopolis, Moon Township, Crescent, and Neville Island. So they formed a joint operating agreement. So they formed the Quaker Valley Ambulance Authority. All of the municipalities appointed representatives to our board of directors. So the municipalities control our organization through the appointment of these board of directors to Quaker Valley Ambulance Authority. So what happened then was, instead of building another building, they decided to share the building that's located on University Boulevard on the other side of the Swickley Bridge. And that way it kept costs down. And they bought their own vehicles, though, over here in Quaker Valley. So right now, we operate, Quaker Valley has 2 ambulances and 1 wheelchair van. And we'll talk a little bit more about that later. But it was a really good demonstration, even back in 1974, when Quaker Valley was formed, of intergovernmental cooperation and the leadership and the vision of the elected officials, you know, at that time. And it's worked very well since that time. So right now, today, we provide ambulance service, as I said, to 15 different communities on both sides of the river. So you may have a Valley ambulance show up in front of your home, or you may have a Quaker Valley. It just depends on which day we're rotating vehicles. So we have a total of 7 ambulances that we man, not 24 hours a day, but we have 7 ambulances in our pool. We typically run 5 crews during the day. So we have a very busy ambulance service. And in the evening, we drop that down to 3 ambulance crews. And then over the midnight hours, that drops down to 2 crews. And that's just all based on call volume. So we do obviously offer services 24 hours a day, both emergency and non-emergency. And we also offer wheelchair van services, which is for people that obviously don't need an emergency ambulance, but maybe they need to ride to the doctor's office. And they're not very mobile, or they need help going up and down the steps. So we offer those types of non-emergency services also.
Scheduled transportation.
Correct. Right. That is typically scheduled through our 24-hour dispatch center that we have located again at our Valley Ambulance headquarters.
Okay.
So last year, you might be surprised, and your residents might be surprised to know that we provided over 12,000 responses to both Valley and Quaker Valley. About 9,000 ambulance calls and about 4,000, 3,000 wheelchair vans.
You have a slide with that here?
I do. Actually, I should probably move ahead on that. Sorry about that. This is just a recap of the crews that I was telling you about earlier. And then let's just move there. There we go. So as you can see on this slide, we do about 8,700 ambulance runs and about 3,500 wheelchair van transports. And the standbys you see there, we do a lot of standbys for football games, for Quaker Valley, lacrosse games, those kind of things, where there's a potential for injury, we typically stand by. So we are very community-oriented, obviously, and we have really some really dedicated employees. We currently have 70 dedicated employees that are both EMTs and paramedics that staff our ambulances.
So let's wait. Let's go back to the run here for a second. That one here. So this is roughly 8,700 ambulance runs in 2016.
Correct.
Is that on both sides of the river?
Correct.
Or only on the Quaker Valley side?
No, that's just on that's the combined. And then, as you can see here, one of the things I wanted your residents to understand, of those 8,700 ambulance calls, what people don't understand is we only transport on about 6,800.
What does that mean, transport?
Well, actually, that's when we're called to, let's say we're called to an accident in Aleppo Township. And we get there, and it turns out that it was a bad accident, but there's nobody injured, fortunately. But we still provide service. We make sure that the occupants of the vehicles are okay. And they refer to the hospital. Right? So that falls into a no transport category. So typically, we don't get paid for that because we're not transporting anybody. So therefore, we don't bill. So about 25% of the ambulance calls we go on, we're not able to bill.
Right.
Which contributes to some of the challenges that I'm going to talk about later in the presentation.
Okay.
In terms of the actual number of calls on the Quaker Valley side, I put this slide in here that demonstrates that we do about 2,500 ambulance calls in the Quaker Valley municipalities, and we provide about 1,700 wheelchair van transports.
Okay. So this is really the crux of it, right? The Valley Ambulance Authority that serves Aleppo Township, they do about 2,479 runs per year. I mean, in 2016, on our side of the river.
Correct.
Okay.
So yeah, we track all those statistics differently for Valley as well as Quaker Valley, and then we do the combined statistics as I showed earlier.
Right. Okay.
So we're very proud of our relationship that we have with Aleppo Township, and we work together with your township manager, and fortunately recently working together with you to do this presentation. We also have a very close relationship with the Ohio Township Police Department, and they provide, us service, and we work together in responding to the residents' complaints for or calls for EMS services. We also have a great relationship with the Aleppo Fire Department. We provide services to them during structure fires to make sure their firefighters are safe. And we also work together with all of the mutual aid, EMS, and fire departments that are located in the Quaker Valley area. So if just for chance that we wouldn't have an ambulance available, and sometimes this happens, Matt, that if someone calls 911 and all of our ambulances are busy, we may have to call in another department. So it might be Northwest EMS, it might be Economy EMS, might be Robinson EMS responding, or even McCandless, Franklin Park, or Ross Westview. So that may happen. And the same thing if we have real critical calls. Sometimes we may be calling the Cochrane Fire Department or the Sewickley from Sewickley to come and respond because they may be the closest available medical personnel available. So we have a really good relationship with all the neighboring.
All the surrounding.
Correct.
Okay.
The other thing that we offer the community besides providing EMS 24 hours a day is some of the residents may be interested in learning CPR or first aid or actually the use of the AED. And I noticed on my way into the Aleppo Township Municipal Building today that there's an AED right here at the municipal building, which is obviously a great idea. And we hope that you never have to use it. But the AED obviously is critical because defibrillating somebody or automatic external defibrillation, if someone does go into cardiac arrest, is critical to their survival. The other thing that we do is we provide, as I said, a lot of standbys at community events and sporting events, as well as working together with fire departments and police department. We also have really good relationships with some of the facilities that are located within Aleppo Township, such as Masonic Village. So we provide a lot of services to the residents there, as well as we provide service in the Quaker Valley side to Heritage Valley Health System, the Sewickley campus, and also Health South, located further south on Route 65. So we do have a lot of both emergent services that we provide, as well as non-emergency scheduled transportation like we talked about earlier. Now, a little bit about our funding. A lot of people may not realize that we provide over $1 million worth of public safety services to the residents of Quaker Valley every year. So our annual budget's about $1 million. And the way we get the funding for that is primarily through ambulance billing. So,
Okay, so I'm sorry, let me interrupt and ask before we get too far down the road here. That's $1 million on the Quaker Valley side, or that's
just on the Quaker Valley.
Okay.
Just on the Quaker Valley side, it's $1 million budget.
Okay.
On the Valley side, it's about another $3 million. So if you look at our combined operation, it's a very large corporation, $4 million worth of public safety services.
Right.
And so just $1 million of that is dedicated to the Quaker Valley side.
Okay. I'm sorry, I didn't mean to interrupt.
No, I'm glad you did. But if you can sort of dive into this slide, I can tell you that the majority of our funding comes from if someone calls 911 and we come and treat them and transport them, then we bill their health insurance if they have health insurance. So we bill Medicare, Medicaid, a variety of different insurance companies. So hopefully we can get the majority of that money from them. The other piece of our funding on the Quaker Valley side is each one of the municipalities has agreed to let us charge a per capita or per person amount. So for example, we look at this budget every year and we try to determine how much per capita revenue do we really need. So for the last several years, we've only been charging $7 per person. So every municipality on the Quaker Valley side gives us $7 per person, which roughly totals about $103,000 currently, because there's about 14,000 residents.
That's this municipal income line here?
Right, this last line.
Okay, so your gross ambulance billing, that's the insurance billing?
Correct.
1.9?
Correct.
Okay.
And now we only collect.
Right, and we're gonna get into that in a second.
Right.
So, but from your revenue side, you get 1.9 in insurance billing and 103 in this per capita, which is basically a fee, a user fee.
A user. It's a per capita fee to help fund the system. That's right.
Okay.
And so, as you can see, though, the 1.9 million here is quite misleading because actually we only collect about 42% of that 1.29 million.
Okay, and that's
the 825 is actually what we're projecting. 825,000 is actually the net of actually what we're going to collect.
Because you're reducing 1.9 by 1.02,
And tell me again why that is.
Why is it that you have that
a line item here for write-offs and allowance adjustments?
Right.
And why is that you're reducing your gross by that much?
Yeah, that's very interesting, and I hope people at home can see the slide.
Yeah.
The resident write-off of 104,000. What we do is, let's say an average ambulance call is $1,000 for transporting you from Aleppo to Sewickley Valley Hospital. Most insurance companies like Medicare only pay $400. So we have to write off that $600. Highmark and UPMC and other insurance companies, they may pay $600 or $700. But still, because you're a Quaker Valley resident and we have this per capita fee, we guarantee that none of the residents here are going to have any out-of-pocket expenses for emergency services. So we write off, we're estimating this year, that we're going to save the residents of Quaker Valley's 11 municipalities $104,000 that would have been billed to them out of their pocket.
Okay, so you bill $1,000 for an ambulance. Is that your number? Is that an average? It's
an average.
That's not a made-up number. That's pretty close.
No, that's very close, right?
Okay. So what is the actual cost that you do to run that ambulance?
About $600.
Okay, so the other portion is anticipated profit, but you realize you're never going to make that.
Right.
Well,
Actually, it's not anticipated profit. Actually, it's anticipated write-off.
Okay.
See, we know that if we only build 600, right, we may get only 60, 40, 50, or 60% of that. So we have to continue to charge the higher rate in order to get the 42 or 44% we're getting now.
No, I understand, but I mean, I'm saying that the difference between cost and expenses, the difference between the amount that you bill and expenses is typically considered profit, even though you're not saying that that's profit that you're going to book down the road because you anticipate you're going to have.
That's right.
I got you.
That's right.
Okay, so $1,000 is the billed amount, $600 is the cost amount, and a Medicare reimbursement is
About
$500. So
right.
even less than your cost.
Correct.
Now, maybe some of the private health insurance companies are going to give you more than Medicare, but it's also not your entire billed amount.
That's correct. Very rarely do we ever collect that full $1,000.
Okay.
And again, the difference for Quaker Valley residents, because you're a resident of Aleppo Township and one of the other 11 municipalities, we guarantee that you're not going to have any out-of-pocket expenses.
Well, we're going to get into that in a second, so don't make that point so emphatically.
Oh,
I want you to keep that bullet in your gun and fire that in a second.
Got it.
Okay, so let's keep going through these two parentheses because I think these are important.
Okay.
So 104, what is that write-off comes from this per capita reimbursement, basically? What's the difference between the 104 and 1.029?
Okay. The 104,500 is actually amounts that would have been billed to residents that we write off.
Because of the per capita.
Correct.
Okay.
The 1.29 million is actually the difference for that Medicare write-off, which we have to write off whether you're a Quaker Valley resident or not.
Right. Okay. So maybe this is the point where we need to get into this per capita.
Okay.
Right? Because you've said it a couple times now, but let me make sure that I parrot back what you're saying to make sure that I understand it.
Got it.
Because the Quaker Valley members have, let me try that again. Because the Quaker Valley municipalities have agreed to pay this fee that you call a per capita.
Correct.
The deal with that is that nobody who is a resident of those communities will pay anything in excess of what their insurance pays.
For emergency calls.
For emergency calls. Okay, so I'll try it one more time. Because the communities of the Quaker Valley Ambulance Authority have agreed to pay this fee, which you call a per capita, none of their residents will pay anything in excess of what their insurance pays for emergency services.
Exactly.
I have it right? Okay.
Exactly correct.
Okay, and so maybe these two line items are out of order, right? Because the $1.029 million allow an adjustment line is reducing your $1.9 million gross in order to accommodate for that which insurance will not pay.
Correct.
Medicare and other insurance.
That we're mandated to write
You're
off.
mandated to not even write off, but reduce your gross by.
Correct.
Okay, you just cannot collect. It's uncollectible.
It's uncollectible.
And then the line, the other line, the $104,000 line, is an amount that, but for the per capita fee, you would be charging directly to the resident.
Exactly
Okay.
correct.
And when we say this, but for the per capita fee, it's important, right, to contrast the per capita fee structure to the other side of the river where you do not have that.
Correct.
Correct? So it's said another way, on the Valley Ambulance side, on the Sewickley side of the river, on the Valley Ambulance Corporation, what's the
Authority.
authority.
Mhm.
We have this structure where the municipalities pay these fees, these per capita fees, and in exchange, the residents don't pay anything above what their insurance pays for emergency service.
Exactly
On
correct.
the other side of the river,
On the valley.
on the
side.
valley side, so on the Coriopolis side, Moon Township
Mhm.
side, they do not have that per capita fee. So the municipalities themselves don't pay anything to the authority. However, when runs come and the $1,000 that you bill for an emergency run is cut by the insurance company, that amount gets billed back to the resident in some portion,
Yes.
right?
Except on the Valley Ambulance side, as we have in many other municipalities, they have a subscription program. So we offer, on the Valley side, we offer them, each resident, each family can voluntarily send us anywhere between $40 and $60. 40 is for individuals, 60 is for a family. If they do that, then we would treat them just like we would a Quaker Valley resident.
Okay. So basically the question is the membership fee being paid individually at the family level, at the individual or family level, or is the membership fee being paid at the municipal level?
Correct.
Right?
So,
Okay.
so we have this per capita / membership fee on the Quaker Valley side that's completely paid for by the municipalities. Therefore, everybody is a member
Right.
on Quaker Valley side. Whereas on Valley side, only the ones that pay the membership fee annually become members.
And so the interesting number actually here to look at is that when you look at this $104,500 as a resident write-off on the second line here, I wonder, I thought I could, oops. I thought there was some way I could easily get a laser or something.
Yeah, I don't.
No, it's all right. So the $104,500 that you are deducting your gross by is actually not even fully made up for by the $103,340 that you're charging municipalities.
That's an absolutely great contrast. That right now we try to keep that municipal income, trying to offset that resident write-off.
Right.
And so you'll see that in 2018 we've already set the rate, and it will be going up by $1.
Okay.
So it's currently $7, but in order to maintain pace with that write-off figure, the resident write-off figure, we will be increasing that to $8.
I got you. Okay, in 2018.
Right.
Okay. All right, so we've looked at your gross, we've looked at your deductions for insurance cuts, we've looked at your deductions for amounts that are not being charged back to the residents. What else is on this slide here?
Well, it also shows that, for example, the number one expense that we have, well, this is only showing our income. But if I go to the next slide, you can see that our expenses, almost the bulk of all of our $1.33 million revenue goes back to Valley.
Okay.
And that $951,000 that they paid in 2016, what that was for was to actually reimburse Valley for their share of the employee cost, of the building cost, and the other shared equipment that we have between the two authorities.
Okay.
So if you want to look at it from a percentage standpoint, if the combined operation is 100%, Quaker Valley attributes about 25% of the expenses and the cost to run the combined authority of Valley and Quaker Valley.
Okay.
So there's, and that's all based on call volume. So about 25% of our calls is performed on the Quaker Valley. And about 77% of calls are performed on the Valley. And that's purely based normally on population.
Okay.
So the other expense that you see here is there's one separate line item for rent of the building, is $12,000, and we have other minor expenses for auditing and those kinds. The depreciation expense that we do in our budget is for the 2 ambulances and 1 wheelchair van that are owned by Quaker Valley. And then we have some legal expenses. We also do a fund trial, which is very successful on both sides of the river. So in October, typically we send out a request to all the residents here to see if they can help us replace ambulances and replace larger equipment. So we do a separate fund drive asking for residents for donations. And each year that's been very successful. We've done it for the past 6 years, and we average about $30,000, $30,000 to $35,000. So that's an important part of our funding structure, and we really appreciate the residents when they contribute to us, because we put 100% of those donations right back into the operation.
Yeah, and I want to echo that and encourage residents, when you get that solicitation from Valley Ambulance Authority, to give and recognize that these are the people that are going to be knocking on your door if you have a medical emergency. And this is a local organization. It's not as if you're giving money to some national organization where the money could go anywhere. This money is going to stay local. It's going to help. It's going to help the people who help you. So I do encourage you to give when you get that solicitation.
Right, and being a nonprofit corporation, even though we obviously have to make some money, all of our money, whether we have a good year or a bad year, it's all put right back into the operation. So there's nobody collecting any dividends or anything from your EMS service. So it's a municipal corporation that's nonprofit, and all the donations that we get are tax deductible. So that's another good reason. So our next slide here, we talked a lot about the per capita already, and said it's $7 now, and it's going to go up to $8 for next year. This is our overall average cost between Valley and Quaker Valley, you asked earlier. And so just the combined cost is about $409 of direct costs. Then there's indirect costs that drive that up to about $600. So on average, every time you see an ambulance on a call, it's costing us about $600.
Okay.
But the raw or direct cost is about $409. So I'll tell you, sometimes I think everybody, even in the community, is frustrated with all these healthcare changes that have been happening for years, and now the indecision right now on the part of the federal government on where healthcare reform is going. But we struggle locally. You have to understand that what we were talking about earlier, having to bill $1,000 for a call, we used to collect about 60% of that, Matt. Okay. 20 years ago or 10 years ago, we collected about 60% of what we billed. That has now fallen to almost 38% because of all the changes in healthcare reform. So that's creating a lot of financial challenges, not just for Quaker Valley Ambulance, but for every ambulance service in Pennsylvania and across the country. So it's a very, very challenging financial climate that we're in. But right now we're doing very well. We're stable, and thanks to the per capita, it helps us. All those revenue sources sort of help us keep our head above water.
Yeah. It must be a challenging calculus. Trying to figure out how much to bill versus how much you're going to get reimbursed, especially again, as you say, when you don't know exactly how much you're going to get reimbursed.
Exactly right, and it's very difficult. But at the same time, all the residents rely on us that if they call 911, they want,
for sure,
a well-trained ambulance and show up in their door within 10 minutes.
Right.
And that's our goal, is to make sure that we have quality, prompt emergency medical services for every resident. Even though we hope nobody needs us,
right.
We do know that 2,500 times last year in the Quaker Valley area, we had to respond to medical emergencies.
Okay.
So really, in summary, we are very, very proud of the services that we provide to the residents of Quaker Valley. And we really do strive to provide the highest quality of EMS care to all of you and the residents of Aleppo Township. And we appreciate your support and the support of the municipalities, because we really need to do it as a team. And so if anybody has any questions, you can feel free to contact us. Probably the best way to get our contact information is to go to our website, which is qvaamb.org or qvaambulance.org. And our contact information is there. There's a lot of great information and sort of a summary of all this presentation. So.
Okay, so I have a couple questions.
Sure.
We talked about, you were very purposeful to make a distinction in terms of the billing for emergency services.
Mm-hmm.
Now, I take it that when we talked about the van transportations, that is a non-emergency service because you said it was a scheduled transport.
That's correct.
Okay, so how does that get paid for? If a resident needs a transport to a doctor's office or to some scheduled event, that is separate and apart from the per capita fee?
That's correct, and that's a really good point, Matt. I probably didn't stress that enough. On any non-emergency service, whether it's for an ambulance or for a wheelchair van, if you call Quaker Valley Ambulance, we have a set of discounted fees that we charge residents of Quaker Valley.
Okay.
So, for example, a normal wheelchair van to go from here to a local doctor's office is about $60 normally.
Okay.
So we have a discounted rate of $55 for residents.
Okay.
But that is billed to them directly, and most insurance companies don't pay for those types of non-emergency
That's
services.
$55 one way or $55
One way.
round trip?
One way.
Okay.
So the difference between us and Access, for example, or those services, is Access will only provide a curb-to-curb service, meaning they won't take you up and down steps, or they won't take you into a doctor's office.
Okay.
So if the residents here have those types of needs, where there's ambulatory problems, where people need assistance coming down the steps, our crew or wheelchair van drivers will actually come to your home, help you down the steps, transport you to the doctor's office, and assist you all the way into the doctor's office, rather than the curb-to-curb service offered by Access. So it's sort of an upper or one tier above normal scheduled transportation. So we try to provide those kind of services to the residents.
Okay. And are those fees the same throughout all the municipalities in the Quaker Valley Ambulance Authority?
Correct.
Okay, so Aleppo residents pay the same as Sewickley residents, and pay the same as Leetsdale residents, pay the same as Sewickley Heights residents?
Correct. All the municipalities have the same discounted fees.
Okay. Let's see, I'm just looking through my notes here in terms of other questions that we might not have covered in the slideshow. Why don't we talk briefly about QRT? Tell me what QRT is.
QRS.
QRS?
I'm sorry, QRS. And that stands for Quick Response Service.
Okay.
So as I mentioned earlier, we have a really good working relationship with the Aleppo Fire Department. So, but they don't have members that are medically trained. So they are really great in fire and rescue. But oftentimes, if our system is taxed, or if there's a very, very critical call within Aleppo Township, there's at least 2 fire departments on the Quaker Valley side that have had special retraining to become what we call Quick Response Services, or QRS services. So, for example, the most likely, and this only happens several times a year, but if there's a critical call in Aleppo Township, we may ask the members of Cochrane Fire Department that's certified QRS to respond into Aleppo. So that may happen occasionally within Aleppo Township. And so, again, we work together very closely with all the fire departments, but there's other ones that are specially trained, and we'll rely on those when necessary.
So the bottom line is that there are some fire departments have sort of hybrid employees that are fire employees, but they also have medical training.
Correct.
Right.
But I would caution you not to use the term employee, because all the fire departments are volunteers.
Personnel. You're right. Fair enough. Fair enough. So they're sort of hybrid personnel that they've received fire training, but they've also received emergency management training.
That's exactly.
And the issue is that in Aleppo, the Aleppo Volunteer Fire Department has not had that training.
Correct. And you know, in the future, we've discussed it with Chief Davis to see if he had interested members. We would be happy to help sponsor their training,
Right.
and help them with those equipment needs. So,
And that may or may not happen.
Yeah,
But the point is that right now they are not trained or staffed to do that. So there are times where you said the system is taxed. What does that mean?
what means is, for example, let's say we have 3 emergency calls going on at the same time, and the 4th one comes in. So we may be trying to get an ambulance freed up from Sewickley Valley Hospital. So there may be a delay.
Right.
So we might ask a fire department like Cochrane Hose to come into Aleppo and stabilize the patient before we arrive.
Okay.
Or if we have to call a mutual aid ambulance service like McCandless Franklin Park to come down from the north because we have no ambulances left, then we may ask Cochrane Hose to come up and again stabilize the patient until we arrive.
Gotcha.
If it's a rescue or something like that, we may also be calling the Aleppo Fire Department for assistance.
Gotcha.
Or if we need assistance, like lifting assistance or other. So we would always try to call Aleppo first, but in the terms of medical training, Cochrane Hose may be responding into Aleppo.
I got you. Do you have an understanding of how many calls go on? So I'm backing out of put QRS
Sure.
From the big picture. Do you know how many calls Aleppo uses per year?
I do, but I don't know if I have that handy. I had it on our website, but it is located on our website. But
Okay.
I'm sorry I didn't
That's
put
okay.
that slide in here. But I can tell you from my knowledge is you are the 2nd largest call volume that we have.
Okay.
And that's really based again on population. So Sewickley having the most population, not counting any hospital calls, does the most calls on this side, but Aleppo is number 2 in terms of the number of ambulance calls.
Okay, so if we go back to this slide here that we saw earlier, this is again, just so we make sure we understand what we're looking at here. This is 2016 total combined ambulance responses.
Yeah,
This
go
is-
to Quaker Valleys.
that's
there
the
it
one
is.
we want. There we
Right,
go.
right there.
So on well, I guess this is important. Let's start from biggest and
Okay.
move down to smallest.
Right.
Okay, so you're saying that your organization as a total
Mhm.
did 6,800 runs in 2016,
Right. I
right?
need to go back one more slide.
I'm sorry.
Okay. So
Okay.
ambulance runs, we did a total of 8,699.
Okay.
And then of those,
Of those 8,699.
right, we only transported on 6,800.
Okay.
So
Okay.
that's
So
that's
six,
about 28% no transport.
right. Okay.
Which we can't bill for.
I get you. I get you.
Okay.
So you did 8,600 runs. An
Mhm.
ambulance left the dispatch point and arrived somewhere 8,600 times.
That's correct.
It transported a patient back to a hospital 6,800
Exactly
of those times. But that's at the whole enterprise level.
Yes.
If we look only on the Quaker Valley side of the river,
Mhm.
2,400 of those, but these are responses. So we're mixing apples and oranges here, right?
Well, this compares with the 8,000 figure.
Right. Okay. So
Okay. That will be apples to
so
apples.
really, you're right. So we're saying you did a total number of responses enterprise-wide, 8,600. And of those 8,600, 2,400 were Quaker Valley.
Right.
So it's really, really significantly stacked in favor of the other side of the river.
Well, as I said before, the rough numbers are, if you look at 100% of our ambulance responses, 75%
Right.
are on the valley side and 25%
Fair enough.
are on the Quaker Valley
Okay,
side.
so 2,400 on the Quaker Valley side of the river. And then my question is, and this is a very long lead into, of those 2,400,
Mhm.
approximately, if you don't know the number off the top of your head, approximately how many are from Aleppo?
I would probably say about 900,
Okay.
but again, don't quote me, but that it's the 2nd largest. So we probably have maybe I'm wrong. I'm probably going to say 700.
Okay. And if we're looking at, yeah, that's the slide I want. Transports versus no transports. Of the ones that you have in Aleppo, how many of them are transports and how many are not transports?
Of the total calls, if it was 700, you take about 25% off the top.
Okay.
And that would result in the number of transports.
Okay. All right. So if there was one thing that you wanted to leave our residents with in terms of what should they drive out of this video? What should they suck out of it? What's the one thing you want residents to know about ambulance?
Well, obviously, we're here 24 hours a day, 7 days a week to serve you. So if you have a medical emergency, don't hesitate to call 911. And we will attempt to provide the highest quality of service that we can promptly, and hopefully, if necessary, save your life.
There you go. All right. Well, thank you so much for being out there.
Yeah,
thank you for keeping us safe.
Thank you.
Thank you for coming in here today and for sharing some information with our residents about ambulances. If you have any questions about the services that are provided by Valley Ambulance Authority or by the coverage that you get with Aleppo Township, feel free to call the office here at Aleppo Township. Feel free to drop me an email, and we'll look forward to talking to you again. Thank you.
Thank you.